local and at a distance. As many of you know, we do go live on the internet. We go on YouTube, have a live broadcast that makes its way around the world. When you're on YouTube, you can do that, and that's what we are on. So for those of you who are joining us locally, you can always go on the internet, go to AskDrFerguson.com. Right in the center of the page, you'll see an icon. Click on that icon. It says Live Radio. When you click on that, that will take you to a YouTube site. Once you get to the YouTube site, click on the little house in the top left-hand corner, and then click on Feed, and you'll be able to see the program live as opposed to just hear it on the radio. And we have more and more people that have been joining us live on the radio from across the world, and we do welcome our local audience to do that too.
Oh, wonderful.
So, you know, that's been going on for a while now. We broadcast live from the Down East Nursing Home, and as many of you know, the radio station is coming out of a Husky at 970. But so technology has allowed us to do that. I stopped seeing patients for a few minutes, and I come and try to share some tips that one can use immediately. And that's the way we try to do that. And so I just encourage those of you who have family members at a distance, they can always catch me on the YouTube. Or those of you who are out of the radio listening audience and you want the family members to catch us, or even if you're out of the radio listening audience yourself, you can catch us on the YouTube. And we also archive the ones that we're able to do. Sometimes we have a reception problem. You know, the internet is still not the greatest out here in Gates County. But when we are able to do that, they do get archived. So when you go to the YouTube site, so it's youtube.com/user/AskDrFerguson, you'll be able to find probably 6 or 7 months of archived programs.
Right.
So that's a little tip to get started there. Hope you're doing well, Bishop.
I am indeed. Chilly wet weather.
You know, it's nice to be missed. I had about 4 people last week tell me, where was I at?
See there.
And that was kind of nice. I actually had 2 patients in the office back to back say, where are you at, Dr. Ferguson? I was on the radio waiting for you, and we didn't get you. So it's nice to be missed. And, you know, we often get comments when we're out in the streets on how much people enjoy the programming. And we do encourage you, when you see me, you see my wife, let us know a topic that you want us to talk about, something you want us to discuss. We're always happy to try to do that. Our goal is preventive health, something that you can do to improve your health immediately. I do definitely recommend that you still continue to see your healthcare provider. But, you know, these are tips that can help you for healthy living.
Exactly.
And that's our goal when we do these programming. And so we obviously have a couple of big days coming up.
Yes, indeed.
We have Thanksgiving and we have Christmas. And, you know, there's a couple of common things that take place during those time periods. And one of those is depression. And another one of those is increase in the amount of food poisoning. So we're going to just touch on those briefly. We'll make it back more into depression. We were talking about that on our last visit, at which time we had some challenges there, and we were going along good. I don't think we finished the topic, and then we went. We're going to talk about it again last week, and we did not. But so that's one of the things maybe we'll get back to today. But talking about. Talking back about this topic of depression and Alzheimer's disease and mixing those in. But before I do that, let's just talk, you know, briefly about some of the food preparation that takes place during this time of year. When you're wiping down your kitchen, bleach is a great thing that will kill just about everything. And wiping down your surface with bleach is very important. When you're cutting meats and things like that, and then you have a cutting board or a countertop, and then you follow right behind there with other vegetables or fruits, that's not a good thing, particularly when they're raw. You do not want to follow behind your raw meat with anything. You want to clean those surfaces, you know, when you're in that setting. Clean those surfaces before you put anything else on that particular surface. Very, very important. That's a good place to get food poisoning. Another place where food poisoning comes in is a lot of times food is prepared and it sits out all day. Because you have people coming in and out, you've prepared a big meal, and you're just moving along with that, and people are coming in and out the house. So you leave the food on the stove, you leave it on the counter, and the food might come out at 1 or 2 in the afternoon, and it might sit out till 10, 11 at night. Well, that's a problem too. You've got the food sitting out for all of this time. It's sitting in the heat. You have people passing by the heat. 1 or 2 may have coughed. Somebody may have picked up something and put it back down. So you got a lot of places for germs to have passed along and to begin to germinate and begin to fester. And so what many times will happen is the germs will, we get food poisoning because enough bacteria have been able to grow in that particular item. So for example, when you get your milk from the food store, it says pasteurized usually, and it has that's kind of a sterilization process. So that milk, when you get it from the food store, has very little bacteria in it, but it still has some. You can never actually get rid of everything, but just a really, really low amount. But if you take a glass of that milk and you sit it on the counter, and now you will allow the bacteria that are in there to grow. And you let it sit out all day, and then you stick it back in the refrigerator. So now the bacteria count in that glass of milk has tremendously increased over what it was when you first poured it out of the fresh bottle. And now you drink that glass of milk that you let sit on the counter all day and then put it back in the refrigerator. Now you got a good chance of getting some food poisoning, because now what you've done is you've allowed the amount of bacteria in that particular item to grow. Now, say you take a sip of that particular milk, and maybe some saliva from your mouth gets back into that cup. Well, then that means it's going to grow that much faster, because your mouth is loaded with all kinds of bacteria and all kinds of small little microbes. Your mouth is one of the dirtiest places on the body.
Oh.
That's why when you get a human bite, you have to be super, super careful and never ignore a human bite. A human bite is actually worse than a dog bite. So never, ever, 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 ever ignore a human bite. And, unfortunately, a lot of times on the holidays, we have trauma as well. Family gets together, and sometimes they get to fighting.
Yes.
And somebody hits somebody, and their knuckles on somebody's mouth, and now they got a cut on their hand. Well, that cut on that hand is going to be a very probable place to get an infection. And so don't ignore anything like that. Any cuts on your hands, anywhere else on your body that comes from a bite. Say you get a little aggressive in your other type of foreplay you might have. Any bite, break to the skin by the mouth, you need to have it checked out. So again, that's a place on. And so I use the example of milk because I knew people could follow that one.
Yeah.
But the meats and the foods on the table will take the same principle. Okay, they've been cooked, they're sitting out all day. The egg salad, eggs are a big culprit. The proteins are a big culprit. Meats are a big culprit. Things like that. And so salad dressings, mayonnaise, things like that. Those are all culprits. Potatoes. So as this food sits out all day and people pass around, they talk. I mean, you don't even have to have coughed on it, but as you speak, you're going to have little tiny particles that will come out in the air. And those can land on the food. So again, the bacterial load on that particular food can go up. As it goes up, your chance of food poisoning goes up. Also, you may have somebody that's prepared something, a few days earlier. And so now it's already had an opportunity for the bacteria count in that particular item to go up. So as the bacteria, the take-home message here is, as something sits out and is exposed to air and people and touch, the bacteria count goes up. As the bacteria count goes up to a certain threshold, then that particular thing is going to be a negative when you take it into your body, and that ends up giving you the food poisoning.
So therefore, they cannot use a smell test.
No, the smell test absolutely is not legitimate in this case. By the time it gets to the smell, you're way behind the 8 ball. So, and it's good you mentioned that. So another common thing that people misunderstand is the expiration date on things. Okay, the expiration date on an item is the date at which time that store can no longer sell that item. That doesn't mean that's the date at which that product went bad.
Mm-hmm.
So if you have something in the refrigerator and maybe you've never even opened it and you've approached that expiration date or even past it, check it out, taste, smell, things like that. Say it's a milk. And that milk will probably be able to last, several days after that expiration date if it had never been opened. Now, once you've opened something, that's when, again, you allow the bacteria to begin to grow. It's more exposed to heat, is in and out of the refrigerator. So that's where you have to be a little careful. So it's a guide, but it's not by any means an absolute date that you see something you've passed the expiration date, now you need to throw it away. That's the date that the freshness is going to be the best. Say you get some ice cream and you open it and it's past the expiration date, but it still looks okay and tastes okay. Well, that's no big deal. So expiration dates are a guide. They're not an absolute date or time that you have to get rid of something, but it does usually reflect on the freshness. So when you do go to the food store, dates you can find. When you're at the food store, they're going to put the things that are ready to expire up front. And if you're going to use it within the next day or so, that's probably fine. But if you're living by yourself or it's only a couple of you and it's going to take you a while to get through that particular item, look in the back and try to pull something from the back. And many times you'll find an older expiration date than what's in the front.
Yeah, that's what I normally do when I buy milk.
Right, milk, juice, anything, meats, look in the back. And see if you can find an older expiration date. Now, we're talking about dates. So you buy something that has a date that's supposed to expire on November the 12th. And it's already November 26th, but you've had that item in the freezer. So now you've changed things all around. It's suggested, depending on who you read and who you believe, that 3 to 6 months in the freezer is a reasonable time. Once it starts getting past there, then you have to be cautious. The canned goods or the corn that you froze last year, and now we've already passed a year, you might want to be pretty cautious with that. But the expiration date is a guide. It's not an absolute by any shape, form, or fashion. So let's talk a little more. Was that pretty clear, Bishop?
Yes, very clear,
okay.
Very clear.
And again, as you're getting into, I'll talk a little more about the holidays. We're getting into the holidays. We got Thanksgiving, we got Christmas. Have other days where family's going to get together and do things together. As you're going into those days, it's important that you don't beat yourself up too bad. This is not the time to go on a diet. Yes, you do want to watch. You have diabetes, hypertension, cardiovascular disease, other issues that you really need to watch your diet. You do want to watch your diet, but don't beat yourself up so bad if you have this big feast and you overeat or you try a little too many things or your sugar goes up a little high. That's a human thing. And I would say just do things in moderation, attempt to, and don't be too down on yourself when you overeat during these holiday times.
Yeah.
I have lots and lots of diabetic patients, and one of the things that will happen, they say, "Oh, I'm gonna see all that good food. I can't eat none of it, doc." And, "Oh, doc, how am I gonna do it?" So I say, "No, eat it. Go on and enjoy yourself.
Yeah.
Monitor what you're doing. Enjoy yourself. You don't have to have the whole pie, but get you a slice." And those things like that. So moderation is the key of life for most times. And when you're talking about eating, and just as a real quick side note, we've talked so many times in the past, but I refer to the Mediterranean diet as being one of the best ways to eat. You can go by my website at askdrferguson.com. At the top, you click on frequently asked questions. So I guess the FAQ. And in that list, you'll find an outline of the Mediterranean diet. So that's just a good way to eat. And when I say diet, I'm speaking of a good way to eat as opposed to a weight loss. But when you eat good, you'll probably lose weight too. And again, as we go through this holiday season, don't try to start a diet during this holiday season. It's only ends up tormenting yourself. You can make some judgments on trying to do things in moderation and trying to be a little more cautious. But dieting during now to the beginning of the year, not a good idea. If you're already on something, yeah, try to keep that going, but not to start it. Make sense?
Yes, indeed. I also mentioned, most importantly, no matter what you do, if one is on medication, they should take the medication.
Absolutely. And check with your healthcare provider. Don't leave them out of this loop. And that's also a very, very important component. And a lot of times people will listen to our program and they'll decide they don't need their healthcare provider. Not true. You absolutely need your healthcare provider. They may not know as much about nutritional and natural things as you want them to know, so you can seek some additional help, but you got to keep your healthcare provider in the loop. Very, very, very important. And for those of you who want to actually see me in the office or talk more about your specific issue, you can always call the office at 252-332-6484. We're happy to see new patients, as well as you may have a question or something you want us to talk about online. We're happy to do that as well. And while I'm talking about that, you also, a lot of my wife, she actually gets more comments on her programs now than I do. And, you know, her program is Talk Back Now with Patricia. And that comes on Mondays from 11 to 12. I think Wednesdays, 11 to 12. And I think Friday, 10 to 11. Is that right, Bishop?
That's correct.
Yeah. Okay. So those of you who enjoy her program, you know, you could leave a message for her as well if you wanted to do that at my office. But don't forget to tune into her program. She usually talks about something of politics and something that's a current issue going on. I'm sure she'll probably talk some about the Ferguson issue today. Yeah. But people,
she had said that she wouldn't. I think Ernie said she wouldn't.
She's not going to talk about that.
She wouldn't be back until next Monday.
Oh, okay. Well, I'm not sure when she's due back.
But she may call in.
Yeah, so I'm not sure about that one. But those of you who are around, you know, catch her program. I'm getting more comments about her program than I do about mine now. So that's a good thing. So let's switch topics a little bit here, and let's continue our talk. We were talking about depression and talking about Alzheimer's disease, how they relate. I think the last time we talked, we were doing a little compare and contrast between depression and Alzheimer's disease. And I think we were talking about, there's a little book out that anybody can pick up from the Alzheimer's Society, Alzheimer's Association. It's called Basic Alzheimer's Disease, What It Is and What Can You Do. And in there, they have a little list called 10 Warning Signs of Alzheimer's Disease. And that's what I started a couple of weeks ago talking to the listening audience about. And we were going through that list, comparing and contrast the things that happen with Alzheimer's disease and the things that happen with depression, because they can look very similar. And for those of you who missed that, you can go by my website, and I guess it would be last week would have been the 19th. So we go back another 7. So go back to the 12th. So it'll be 11/12/14. We started talking about Alzheimer's disease and comparing and contrasting that to depression. So if you go back to that, you can catch that. So I don't remember where I left off, so I'm going to start in the middle. I'm going to start on number 5, and we'll kind of go from there and see if we can make it to the end. We don't have much time left. We may not make it to the end today.
Okay, we got about 12 minutes.
So on there, again, these are warning signs for Alzheimer's disease. You see these types of things in your family members, so forth. Get them checked out. Get them checked out by somebody who knows something about Alzheimer's disease, has a love for it, and working with patients in this category. I had a family member just yesterday. No, not yesterday. Earlier in the week. Who, you know, has a family member with Alzheimer's disease, and they're seeing a healthcare provider who's not really jumping on top of it, and you know, they're asking me questions about it, and I'm, you know, making some suggestions about things that they might want to try, might want to do. So if you have a family doc that you really enjoy and you've been working with them a long time, I'm not telling you to leave that family doc by any means, but you might just ask them to send you to a specialist to further assess the Alzheimer's process. And if you look at the data, family docs actually probably do 60 to 70% of Alzheimer's work, and then the neurologist would do the rest usually. But that is one of my specialties, and we're always happy to see patients in that category. So number 5 on the list of the warning signs, they describe it as poor or decrease in judgment. Now, what does that mean? That means the poor decrease in judgment. Your judgment would be what you decide to do or not do. You might mix the word wisdom in there with judgment. Judgment would be a poor judgment. You take a metal plate and you stick it in the microwave. Obviously, that's poor judgment. You go driving and you know you shouldn't because you left your glasses at home. Obviously, that's poor judgment. You decide to walk across a busy street before the light turns green. That's poor judgment. And these are some of the things that an Alzheimer's patient will begin to do more and more of because they don't really understand anymore. So they begin to have poor judgment. Now, the depressed patient They may have poor judgment just because they're in a mode of I don't care. I don't want to be bothered. Don't tell me about it. Don't show me. Don't do anything. I don't care if I don't eat. So their poor judgment may come for that reason, just because they're down and out and don't want to be bothered. But if you press them, they can probably have correct judgment. So that's how that can look alike. Next one is problem with abstract thinking. Now, an abstract is when it's something that's not right in front of you, something that it's kind of like a riddle. It's kind of like a proverb when you talk about an abstract. So an abstract would be, if you live in a glass, what does it mean? If I say, if you live in a glass house, you should not throw stones. Well, a person with Alzheimer's disease will say you'll break the house. But the real meaning will be, well, you may be just as bad as somebody else. So how are you going to talk about it? The grass is not always greener on the other side. So the real person, the Alzheimer's patient might say, yeah, it's brown. Well, we're not talking about grass at all. We're talking about your situation. If you're not doing so great over here and then you change jobs, thinking it's going to be better because you changed jobs, and it's just as bad over there because you took the problems with you. And so that's how that would mean. And so those we call abstracts. And so a person with depression, they'll know the answer. They'll be able to do the abstract part of it, but they may not want to. So you may have to push them. So you ask them those answers, and they may just want to get you out of their hair or get you to stop talking to them. They may say you break the house. But if you push them, they'll usually be able to come up with the right answer. Misplacing things. Anybody can misplace things, but is there a pattern of misplacing things? So if you've always misplaced things, that's one thing. But if it's new, that might be a sign that maybe Alzheimer's disease is coming on. The depressed patient may misplace things just because they don't feel like thinking about where they left it. So a lot of times the depressed patients, they're just going to be secondary to apathy, secondary to I just don't want to be bothered, leave me alone, I don't want to think about anything. And so that could appear to be Alzheimer's disease. So it's very important that when you're a person and before you diagnose them with Alzheimer's disease, that you do evaluate them for the potential of depression. I mean, I can remember growing up, from the time I can remember, my grandfather, he always lost his keys. Okay, he never knew where they were. So was it Alzheimer's disease, or he just never knew where his keys were? Well, early on, he just never knew where his keys were. And so you have to kind of put it all in context. Is this a pattern of a person? They're always misplacing something, never can find it? Or is this something new? Now, if it's something new, they've always been very neat and organized, and now they don't know where their keys are, they don't know where this is, don't know where that is, but that could be a warning sign of Alzheimer's disease, and that's the patient you definitely should have evaluated. Change in mood or behavior. Well, again, obviously a person that's depressed, they're going to have a change in their mood and behavior. They're not, they may be sad, they may be down, and they may look just perfectly normal, but that doesn't mean they're not on the inside hurting or crying or feeling bad, feeling sad, down, don't want to be bothered. Where the Alzheimer's patient, they may have been very mild and meek and mannered, and now they're fussing and cussing. So that would be a significant change in mood or behavior. Or say your mood is normally very pleasant, or say your behavior is normally very easy to get along with, and now you want to fight with people. So that might be a sign that this person is having some signs of Alzheimer's disease. A change in personality. Say you used to, and that kind of, I just mixed kind of behavior and mood with the personality, because it kind of flows one to another. The personality to be more continued, that's the way you are all the time, where the change in behavior might be just that's the way you are today. But say you used to be very easy to get along with, and now you're always grumpy and don't want to be bothered and don't touch me and leave that alone. Well, that would be a change in the personality, and that could be one of the warning signs of Alzheimer's disease. And the person that's depressed might also have a change in their personality. Again, much of their centers around don't bother me, apathy, I don't want to be bothered, I just feel like being left alone, I don't have any energy, those kind of things. But anybody can be depressed at any time, male, female, young, old. So don't just assume just because a person is a comedian that they couldn't be depressed, because they can be very easily. And this is a time of year where depression is a bigger deal than other times, because it's the holiday season. More people commit suicide this time of year than other times of year. So if you have family members or friends that are prone to be depressed, don't ignore the comments they make. A person is bipolar in their depressive component of bipolar. Don't ignore the comments they make, because some of the comments they make may be pretty serious. And so don't take them for granted that this just means nothing.
Right.
Depression is a real big deal. And when a person's depressed, they can do things that are abnormal. They can become aggressive because when right at that moment they're in a point of, I don't care, I just need some relief of how I'm feeling. And to do something dangerous or threatening or shoot somebody or shoot themselves, that could happen, because what happens is the person that's depressed in that moment, they're saying, I'm just going to explode if I don't get some relief. And they may take a very unwise thing to do to get that relief.
Mm-hmm.
They may be driving down the highway and they're overtaken by depression and sadness, and they may just floor it and say, I don't care if I live or die. Okay, well, obviously they didn't stop to think about the consequences. They didn't stop to think about the judgment. They didn't stop to think about, well, what happened if I don't die? I'm going to be stuck in the hospital for the next year. Am I going to be all broken up? So when a person is depressed, they're not going to put that rationale and reasoning into place, just like a person with Alzheimer's disease is not going to put that rationale and reasoning into place. And the last one in that list, and I know we're coming near the end of time, is a loss of innovation. So loss of, you've got to get from the living room to the dining room and the couch is in your way. So innovation would be, well, walk around the couch. Loss of innovation would be to sit there and say, I can't make it to the other room because that couch is in my way. So in being innovative, you're say you're a good cook and you're missing one of your great ingredients, and you go to the kitchen and you say, well, I guess I'm not going to be able to make that sweet potato pie because I don't have XYZ. So that loss of innovation. A person that's in their normal mindset many times will be innovative when it comes to, you got to fix something. You're in the garage, something's broken. Say, okay, what can I use in place of this? That's what we call innovation. Now, a person that's depressed, they're usually not going to be very innovative because they're depressed. When the person's Alzheimer's disease, they're not going to be innovative because they've lost that ability to think of those type of things. Okay. So I know we're near the end, but for those of you who want to see me in the office number is 252-332-6484. You can always go by my website at askdrferguson.com. You can go by YouTube, youtube.com/user/askdrferguson. And if you forget all of those things, there's plenty of places where you can go online and find me. Just type in the Google search window or any of the search windows, type in Stephen Ferguson MD, Ask Dr. Ferguson. All of those will take you to multiple pages that I have on the internet.
Okay.
So I hope that was clear. And to all of you, I hope you have a wonderful Thanksgiving, wonderful happy holidays, Merry Christmas. When I say happy holidays, I'm always a little hesitant because I read the better thing for me to say would be, that Jesus is the reason for the season. But when you try to catch everything, you end up saying happy holidays. So, but just remember, as you approach Christmas, that Jesus is the reason for that season.
And during the holiday season, not always holiday season, there are some people who will, even though we don't condone it, there's some people who will partake in alcoholic beverages. Just ask them to please be moderate and do not drink and drive.
Absolutely. And on that note, I guess our time is about up. I'm going to say to you, Bishop, and to our entire listening audience, be blessed and have a wonderful day.
You too, Dr. Ferguson. Thank you.
Bye-bye. To those of you who are catching us live on the internet, tell your friends about us. So every Wednesday from 9:30 to 10, we do the program live. When the internet is working well, we're able to archive those so you can go back and catch some of the previous programs. The quality may not be the greatest sometimes because of we have a slow internet here. Unfortunately, that's all we have here at the nursing home, and it's in a rural area, and that's sometimes you don't have the high tech of the big cities. But regardless of that, the information is always going to be good. And so sometimes if there's a disconnect between the voice and what you're seeing, then just let the volume go as opposed to trying to look at it as well as hear it. Sometimes it's been kind of like a Chinese movie where the words don't match the mouth, and I would have a hard time listening to that myself. But I continue to do the program because I know the information is good. I get comments all across the world where people tell me how much they've enjoyed it, how much it's helped them, and that's what keeps me going and keeps me doing this. So to all of you, be blessed and have a wonderful day as well. Bye-bye.